Good afternoon. I'm Dr. Sandra Martell, the Public Health Administrator for Winnebago County, and welcome to our afternoon briefing. So I'm going to kind of reference this. There's been a lot of negative information in the media, but we're going to talk about miscommunication during a pandemic. As with any emergency, communication is often the first point of failure, whether you're talking about 9/11, whether you're talking about flooding, or even the initial phases of a pandemic. Situations are rapidly evolving, and typical communication systems are overwhelmed. I want to be clear that it was the understanding of the Winnebago County Health Department that we were to administer all available vaccine as first dose that we had received. We were told not to hold back, that the systems would be prepared to provide us with our second doses. And I want to also be clear that our health system partners assisted us in the administration of those first doses, and they were also not instructed to hold back any allocation for second doses. We track every week, first dose versus second dose, products that are out there, what clinics we have coming up, what sessions we have, so that we know how many first doses we need to prepare for and how many second doses. And we track at least a 3-week look ahead, because most of our vaccine, Pfizer is at 21 days, as we know, Moderna at 28 days. So the second doses that we've been tracking arrived this morning and were distributed to all of the health systems to administer to their patients who were postponed this week. But I want to remind the individuals who've been calling and worried about those second doses that their health systems are reaching out to them to reschedule them from their postponed appointments. Please do not overwhelm their call systems. They know, and we have always had our commitment, that where you received your first dose, you will receive your second dose, and we plan for that way. I also want to encourage and really talk to our media partners about this. A delay in a second dose does not impact the effectiveness, nor does it require that the series be repeated. We need to be very clear with the population and the public, because it creates fear that is not warranted. We appreciate the patience of the community and their understanding as we work through this. We also appreciate the support of the Illinois Department of Public Health and the Governor's Office. We recognize, too, that they are working under tremendous stress as we roll out vaccinations. Based on data from our Qualtrics, over 12,000 vaccinations have been documented since January 4th of 2021. I want to be clear that that does not include vaccinations that have been provided by the health systems, because they document through their electronic health records. The first of operations supported by the Guard was over 4,000 vaccinations administered in 1 week. And most of those vaccinations have been first doses. And I know there's a lot of emphasis, is vaccine going to the community-based Guard site? Where is it going? And I want to remind people we have 2 different strategies. We have what we call the fixed site at Sandy Hollow, which is our community-based vaccination site, and we are also out at various essential work sites. So to date, we've been at Auburn High School, Collier Gardens, Constance Lane Elementary, Costco, Diagnolo Gardens, Hononegah, Independence Village, Jefferson High School, Johnston Gardens, Marathon Health, Mosaic, Oak Street Health Center, Park Towers, Peterson Meadows, Rockford Environmental Science Academy, Rolling Green Elementary, Rosecrans Harrison Campus, Rosecrans Weir Center, Sienna on Brendanwood, South Beloit School System, TH Foods, Valkeman Plaza, Wesley Willows, the Winnebago County Health Department, the Winnebago County Jail, the Winnebago High School, including Durand and Pecatonica schools, and Woodman's. And we continue to vaccinate the essential workers in their workplaces. To date, over 1/3, 32.5%, or approximately 1/3, were 65 years of age and older. I often hear that that group is being left out. and they only represent 18% of our population, so they are vaccinating as we would expect as part of Phase 1B at a higher rate. 2/3 were between the ages of 18 and 64 years of age, and that reflects our essential work groups. But remember, neither one is exclusive. You can be 65 years of age and older and be in part of the frontline workers, as well as healthcare workers can be in both of those categories. Phase 1A, which was essential healthcare workers, 23.8% of all vaccinations have been administered to that group, and the rest, 76.2%, have been what we call Phase 1B. And when we look at the top occupations and industries, 30.4% were in education or childcare, and I want you all to get a little one on this one. 28.4% were retired, so that reflects our senior population as part of the Phase 1B. 8% identified themselves in healthcare, 5.5% were manufacturing, and 4.5% were first responders or firefighters. So I always liken this. I hear are there hard stop and start lines to each of the phases. We have to keep remembering that's not how it works. It's more like a wave in the ocean. So as we start, we kind of have to loop. We started with Phase 1A, healthcare workers. That group got expanded. We started Phase 1B. We're still catching up with some more Phase 1A as they register and become eligible. And now we've introduced Phase 1B+, which included individuals with a smoking history and individuals who had met conditions associated with the Americans with Disabilities Act. Individuals who need to update their registration regarding disability status or smoking can go to the website for the link, but they will need to remind themselves to make sure that they're using the same name and same phone number that they use to validate their registration because it is unique to them. Planning continues to identify a site on the west side of Rockford to increase access for our communities of concern, including our Black and Brown communities that had the highest risk of disease burden. Zip code 61108, 61109, and 61016 were some of our highest communities, and we know that we need to continue that. And I want to remind my communities of concern and my minority communities, now is the time, don't wait. Only 5% of our registrations to date have identified themselves as African American, and we know that people are hesitant to register, hesitant to vaccinate, but now is the time. We need our adults in our entire community to vaccinate to help protect our children who are not yet eligible for vaccination so that we are able to support to an increased environment of in-person learning. We also had some other good news on the front this week. The Johnson & Johnson announced their COVID-19 vaccine. You will see it referred to as Janssen COVID-19 vaccine, which is the pharmaceutical division of Johnson & Johnson, but is all the same vaccine. We anticipate that it'll be arriving at the end of this week in Winnebago County, and we will begin using this vaccine. I think everyone's heard about the advantage that it's one dose. Like Moderna, it's for individuals 18 years of age and older. And while it's been a lower reported efficacy rate in preventing moderate to severe, it has a high efficacy rate in severe outcomes for symptomatic COVID-19. And it is identified as 100% effective against deaths. It was also tested in countries of South Africa and Brazil where some of the variants were found, and the testing dates were later in that. I think the other interesting thing to learn about this vaccine is the most commonly reported side effects were fatigue, headache, and myalgias or muscle pain. But I want to caution the community that you can't compare vaccines head-to-head because they were not involved in head-to-head clinical trials. They were also evaluated at different time frames where different variants were in place. So whatever the vaccine product, take the first available appointment, take the vaccine that's available. We are going to continue to work through this pandemic. We are constantly learning more about this disease, the variants, and the vaccine products we have available. Today we are reporting 20 new cases. Once again, ages 9 months to 87 years. This disease does not know any age boundaries. It brings our total case count to 26,813. Our rolling positivity rate is 2.3%, and for those of us who remember how high it was earlier, it's a welcome sign that we are below 3% consistently. But unfortunately, we are reporting 2 additional deaths, And we mourn with those families and offer our sincere condolences. Too many residents have lost their lives to this disease, and it brings our total death count to 440. And we have no new locations of concern to report today. So with that, I'm going to turn it over to Mayor McNamara.
Thank you, Dr. Martell, and as always, appreciate your work on helping our community fight the pandemic, as well as your entire team. First, I want to begin by thanking all of the partners and the individuals who helped bring that community vaccination site to a reality. We came together incredibly quickly just about a week ago, and we're continuing to refine those operations, make it as quick and efficient for our residents to get through that site to get their vaccine. I want to give a specific thank you to the Rockford Public Works team. There's a whole host of folks who went into helping the site, from First Midwest Group to the Fire Department to Winnebago County Health Department, the National Guard, IDPH, IEMA, you name it, they were helping us. But in the back end, our Public Works team has been out there, helping remove snow, filling potholes, making sure that there's wayfinding signs, making sure that the access to it is as easy as possible from the second you turn onto that site. So I just want to say a big thank you to them. And they're led under the direction of Public Works Director Kyle Saunders. Also want to give a special thank you to a number of organizations that have come together and have stepped up to help assist patients at the Sandy Hollow vaccination site. Volunteers from Rockford United Labor, AFL-CIO, the NAACP, American Association of University Women, Rockford Today Network, the League of Women Voters, Rockford's Women's March, have all committed to help at that site for the initial 90 days of that site's existence. So again, just a thank you, and I think that speaks to the nature of Rockfordians. We come together and everyone wants to be part of the solution. So a really sincere thank you on my behalf and Dr. Martell's behalf for your volunteerism. Throughout this process, we've asked citizens to continue to be vigilant. We've asked them to continue also to be patient. And lastly, we've asked them to continue to work together. I think throughout this entire time, Dr. Martell and I have come to these now weekly press briefings and spoken to all the citizens as adults, providing the information that we have at that time. Millions of Americans, including Rockfordians and residents of Winnebago County, are eager, anxious, and very naturally a bit impatient to receive their vaccine. The process is incredibly complex to get from the manufacturing site where the vaccine is manufactured to getting that shot into an individual's arms to be vaccinated here in Winnebago County. However, the bottom line is, as Dr. Martell noted, that we are ramping up vaccinations here locally, and we are making progress. As you might expect, we are getting lots of questions at the city. I myself am getting questions. City council members, our team members are getting questions. So I just want to share some important information that I think will bear repeating as we move forward in the weeks ahead. If you have not already, please go to wchd.org and register for the vaccine. Again, if you have not already, please go to wchd.org and register for the vaccine. If you don't have access to a computer, you can also call in, and the COVID hotline number is 815-319-6705. 815-319-6705 to help you register for that vaccine. Those who register, they're prioritized based on age, occupation, and of course, medical conditions. Vaccinations are given by appointment. There are no walk-ins at Sandy Hollow vaccination site. So there's no walk-ins. You have to register. You have to have an appointment. When it is your turn, you will receive an email or a phone call from the Winnebago County Health Department prompting you to schedule that appointment. If you make an appointment and you cannot keep it, this is important. If you make an appointment and you cannot keep it, no one's going to blame you for not being able to keep it. Life happens. Sometimes big things come up. We simply ask since we have a no waste policy, that you call the COVID hotline at 815-319-6705. Your appointment cannot be transferred to anyone else. So if Tom McNamara has an appointment, I cannot then transfer it because I have an important meeting or a death in the family. I can't transfer it to another loved one or to a friend or to someone I owe a favor to or someone I lost a bet to. You have to be that individual who has an appointment. You were selected based on your individual criteria. If you cannot make the appointment, it will be reassigned to the next person who has registered and meets the criteria of that current vaccinations. You will then be rescheduled. So you won't lose out, you'll still be able to be scheduled. But we want to ensure that none of the vaccine goes to waste. Another thing, you cannot select. I've heard it said before, it's not Burger King, you can't select exactly what you want, but you can get a vaccine. That's your big choice. Are you going to get vaccinated or you're not? I certainly encourage everyone to get a vaccine, but you can't select between Moderna, between Pfizer, between Johnson & Johnson, or as we call it, Janssen. This type is simply provided based on the supply that we have at that time. We're asking you to be patient. When you look at phases 1A and 1B, it roughly represents about 2/3 of Winnebago County's population. And the supply that we get from the state is limited, so please be patient. As you've heard, we are working through the registration list as diligently as possible and are working with the supplies that we receive. Finally, I do want to address something that's been simmering over the last couple of weeks. Just being honest with you, personally frustrating to me. In Dr. Martell. And Dr. Martell, who's been here now over 65 times in front of you, we have, as a community, a public health administrator who's focused on one thing since the very beginning of this pandemic: keeping people safe, keeping people healthy who live within Winnebago County. That's what we have in Dr. Martell. Now that we're seeing the vaccine supplies continue to grow, she's now focused on getting shots into people's arms who have chosen to get vaccine. That's exactly where her energy and her team's energy should be placed. Want to be absolutely clear, or as in famous movies said, crystal clear. Dr. Martell nor her team missed anything. Dr. Martell nor her team missed anything. Other thing we should be clear about: this is not the time to play games. This is not the time to point fingers at individuals or play the he said, she said game about issues of our supply. Our sole focus during this pandemic should be making sure that those citizens who need the vaccine get the vaccine in their arms, and how we vaccinate as many residents in our community as quickly and safely as we possibly can. So in closing, I would encourage everyone to help their family and friends if they are having challenges registering for an appointment. You can register, as I mentioned previously, at the Winnebago County Health Department website, wchd.org, or you can call the COVID hotline at 815-319-6705. You can also find locations of pharmacies across the state that will be offering vaccine by visiting www.dph.illinois.gov/COVID-19. We are making progress here in Winnebago County, and we will continue to do so in the weeks and months ahead. I appreciate your patience. I know the staff that have been on the front lines throughout this entire pandemic appreciate your patience. The staff over at the EOC, Dr. Martell, the Winnebago County Health Department, appreciate your patience, and we will absolutely get through this when we're working together. Thank you.